Hi, my name's Megan Meehan. I'm currently working at the House of the Good Shepherd foster care unit as a primary therapist intern. So I put this grief training webinar together in order to help individuals with processing grief and loss with children in the foster care system. This webinar consists of several parts. There is an introduction to the topic area discussed, a response to loss plan, including the initial response to the loss, the response team gathered as well as their responsibilities, the interventions that can be used with a child in this situation, several tips on what to do and not to do when helping a child in foster care process a loss, and finally there is a section for resources. This includes community-based resources, online resources, and scholarly references that can be used. As has already been stated, the setting that this webinar is focusing on is foster care agencies around the United States, the target audience being primary therapists, caseworkers, and foster parents. Foster children experience numerous different types of losses, some of which being the death of a parent or guardian, being taken away from home, having to change schools, or being introduced into new peer groups. The main loss that this webinar is going to put the most focus on is when the child is taken away from a birth parent or guardian. Some of the feelings and emotions that accompany this type of loss for a child include a loss of a sense of personal control, guilt, confusion, anger, depression, vulnerability, and loneliness, as well as a multitude of others, which can make dealing with and processing a loss very, very difficult. There are also several myths that are associated with these types of losses. One is that there's a specific way that everyone should grieve, and if you're not doing it that way, you're wrong. Now that's plain and simple not true. The way that we all grieve is very subjective to how we are as an individual and can be very unique. A second myth is the notion that we should just get over it. Honestly, there's no timeline that can be said to accompany the grieving process. As has already been stated, we're all unique individuals and need to process things in our own time. And finally, a third myth is that it's not okay to talk about the things that make us sad or mad. Being able to talk about the things that we're feeling is a very helpful coping mechanism when it comes to processing through grief and loss. The response to loss plan in the foster care system attempts to address all areas of the loss that need to be handled by personnel. We are going to talk about the response to loss plan in 3 sections, the first of which is the initial response to the loss. There are 2 things that are essential in this section: the verification procedures used and the communication system put in place at the agency in question. Now, depending on the agency that you're working with, there may be specific policies in play, so this is just a simple example of how it could be handled. A verification procedure involves validating the loss and avoiding the spread of rumors. With the loss in this case being the child taken away from his family, it's impossible to stop rumors from being spread in the community or the child's schools as to why they are being removed from the home. However, in the agency itself, it is the caseworkers and primary therapists that are responsible for communicating with the child as to whose case they are assigned. Moving on to the communication system. Communication in foster care is essential. The most efficient way to make sure that information is communicated to everyone involved is by creating a phone tree in which each team member involved in a case can be responsible for notifying another of any updates and changes. The team section of the response to loss plan focuses on the key players that work together to handle different aspects of the loss. In the foster care setting, the players that make up this team are the child's caseworker or case planner, the primary therapist, the foster parents, the agency psychologist and psychiatrist, the child's lawyer, and the child's teachers and school counselors. These team members each have specific roles that they play in advocating for the child in question. The caseworker or case planner is responsible for home visits to ensure a healthy and happy situation in the foster home for the child. They help put together a permanency plan for the child, as well as act as a liaison between the school, court, foster parents, therapists, and foster clinic. The primary therapist is responsible for working with the child to help them establish healthy and effective coping skills, process through the grief with them, give them a chance to work through their concerns and issues, and help build positive self-views in the child's eyes. The foster parents are responsible for housing the child and giving support and stability in their home life. Foster parents can also help to reinforce the goals that are established in the sessions with the child and the primary therapist, as well as support the healthy coping mechanisms that the primary therapist is working with the child to produce. The agency psychologist is responsible for performing interviews with the child to try and get a good understanding of the child's mental health status and either diagnose, support a current diagnosis, or re-diagnose a child with a potential mental disorder. The agency psychiatrist then works to come up with a good medication to help the child with any mental health conditions that may persist. The child's lawyer advocates for the child in the courtroom setting, and the teachers and school counselors are responsible for addressing the needs of the child in the classroom or whether grief, loss, mental health is impacting the child academically and how they could handle it better. There are countless interventions that are available to help treat or work with individuals on processing grief. When you're selecting an intervention to use with a client, it's important to take into account the client's specific needs as well as what you feel comfortable with. 3 possible interventions are creating a safety plan and a myself plan with the child, helping the child create a coping toolbox, and psychoeducation. And the specific example that I will be using is a learning through film Disney version. Safety plans are geared towards making the child feel safe. Oftentimes, children in foster care don't feel that safety. They feel very vulnerable. Giving them that safety plan helps them to feel somewhat in control and more comfortable in their situation. The myself plan refers to the self model, SELF, referring to safety, emotion, loss, and future. We can use this model to create goals for the child with them. Self is a way to work through past trauma and loss and make sure that you don't repeat the negative behaviors of coping mechanisms in order to work towards a safe future. Using this intervention, you can have the child identify something in each one of the 4 categories. Once this is identified, they can identify a corresponding goal that they have in order to find healthy coping mechanisms. Creating a coping toolbox with the child entails having the child write down on paper all the things that they would put into their toolbox, and then they can create these toolboxes themselves. The goal is to fill the toolbox with things that bring them comfort and have been discussed with the therapist and agreed upon as healthy coping mechanisms. An example of this could be a soft bear to give a hug to, a CD with songs that make you happy on it, a book to entertain you, an air freshener with a smell that reminds you of happy things like chocolate chip cookies, etc. By creating a coping toolbox, you're giving the child physical things that they can go to themselves when they're experiencing grief or negative emotions over loss and help themselves come back to a happy place. And the third and final intervention that we're going to discuss is learning through film, the Disney version. This is a psychoeducation approach to grief therapy, and it involves having the child watch clips from Disney films accompanied by guided discussion questions that aid them in recognizing emotions of loss and grief experienced by the characters, as well as evaluate their responses to these losses and determine if it was a healthy coping mechanism that was used or not. 2 other beneficial interventions that can be used are empty chair technique and role-playing that can be used with a therapist. This is an abridged list of things to do and not to do when helping a child cope with loss and grief when in the foster care system. Some of the things to do are be patient, be aware of the cultural and religious rituals of the child in question, be sympathetic, and be supportive. Do not be judgmental, minimize the grief that the child's experiencing, expect the grief to be the same for everyone, or discourage the emotional expression of the child. These are all very, very important things when helping a child process through grief. As a way of following up with the tip to be aware of cultural and religious rituals of the child in question, this segment is dedicated to discussing cultural competency. Many of the individuals entering foster care are coming from different backgrounds and cultures, so it's very important to be able to understand where they're coming from. This helps to build a trusting relationship, which in the foster care system can make all the difference. Religious customs in regard to loss can also be very different. Lemming and Dickinson write that religion can help keep individuals reality-oriented when the order of everyday life is challenged, in ways such as death and loss. In many ways, this can be one of the biggest coping mechanisms that one can use, because when you give up some responsibility and control to a higher power, it doesn't make you feel quite so helpless in a loss situation. Different religions grieve and interpret death in different ways. Two examples of that is Christianity and Judaism. Although both have very similar tendencies, the Christian and Jewish religions have funerals and mass services. The Jewish religion requires specific grieving types. For example, you wouldn't want to push a traditional Jewish individual to go out in social gatherings right after the death of a family member because they might be practicing Shiva. Shiva is the traditional mourning process in the Jewish religion that involves a week worth of grieving with specific requirements, as well as 30 days of abstaining from taking part in social events. Another culture that processes grief and loss in a specific way is the Hispanic culture. Most Hispanic populations practice the Roman Catholic faith, but not all. With the Hispanic American culture, there's a high involvement of the priest in the funeral plans. Many times, Hispanic survivors commemorate the loss of their loved ones with promises and commitments. These promises and commitments are taken extremely seriously, and those who do not follow through on them are often looked down at. Depending on the location of your agency, there are going to be different types of community-based resources available to you. These resources listed are 5 examples of resources that are utilized by the House of the Good Shepherd here in Utica, New York. One example is foster parent training courses, which enable the foster parent themselves to learn different ways in which they can help the individual child that they are assigned. The Center for Family Life and Recovery, that has their main offices located in Utica, New York, offers services such as individual, couples, and family therapy sessions. Another, the Community Health and Behavioral Services Department, CHUBS, also offers services in mental health counseling that can be utilized by birth parents to help make for speedier reunification with the child and birth parents. A fourth is the Milton Abelow Children's Shelter, known as MAX, that offers emergency housing and diagnostics for children that have to be placed into foster care. Finally, there are grief and loss supports groups one is specifically located in St. John's Church in New Hartford, New York, and there are many other in surrounding churches in the area. Listed here are 5 different online resources with 1 or 2 sentences below them discussing what they're actually about. Thanks for listening to this webinar. I hope you enjoyed it and felt that you learned a little something on how to help children in foster care process through grief and loss.